Hello guys, I'm Christina. Welcome back to my YouTube channel. Today I'm back with another informative video. So, if you are planning to give your OSCE examination or preparing for your OSCE, then here we are at OSCE Expert and you can contact us at the given contact number or the email address. Here at OSCE Expert, we provide end-to-end support throughout your OSCE journey. You will receive training and guidance from the experienced trainers and educators who are based in NHS for years. You will receive 24/7 online support till the time you pass your OSCE examination, and you will also receive physical classes that are going to be of immense help for you. You can follow us on our YouTube channel for OSCE skill stations. You can also follow us on our Instagram account or TikTok channel for OSCE skill stations, tips, and interview preparation. At OSCE Expert, you will have the guidance and support till you become an RN. Today, I've got a very important topic for you, which is going to be very, very useful if you are planning to give your OSCE examination. Let's come to the topic of the today's video. In this video, I'm going to talk about the common mistakes students make during their OSCE examination. If we start with the assessment station, the common mistakes that student makes is the timing and duration of checking the OPS. So, if you are checking vital signs, make sure that you check for the correct duration. If you're taking pulse rate or respiration, make sure it is checked for the correct duration and the values that are measured are correct and documented correctly. Because if you will mention some other values, your examiner will know and you will be directly failed in the examination. So, for the assessment station, remember the correct duration and documenting the correct values as well as the correct documentation, which means mentioning correct date, time, and your signature at the correct place. Also, you have to mention the values at the correct place in the chart. For example, there are scale 1 and scale 2 provided for documenting SpO2, and depending on the patient's condition and assessment you have to document SpO2, and some students can make mistake in documenting that. So documentation and correct duration for checking ops. Once you have completed and checked ops, while you are verbalizing the result to the patient, make sure that you are telling the patient about the correct escalation criteria of the new score, and also to mention the hourly monitoring that is required, how much hourly monitoring is required for the patient, and what is the correct new score. So make sure that you verbalize that thing correctly. If you talk about planning, what are the common mistakes students can make? The common mistake the students can make is mentioning the contradictory statements to the patient's condition. For example, the patient has got spinal fracture and cannot mobilize, and student is mentioning in the care plan that he or she will provide Zimmer frame or the incorrect type of hoist movement. So it can be a big mistake and you can be failed in your planning. Coming to implementation, the common mistakes that can be made is wrong dosage, wrong documentation, and wrong medication. So, coming to ID check. For implementation, you have to do ID check twice, and some students fail to do and forget to do the second ID check. That can be a common mistake. And dosage, for example, if you have to administer 1 gram of any medication, and the dosage available there is 500-gram tablets, so you have to give 2 tablets. So sometimes if you're nervous or anxious, you may forget that and you may administer wrong dosage. So that can be a mistake. And documentation is very, very important because you have to sign at certain places. So make sure you practice correctly what all places you have to document at implementation status, what all places you have to give your signature, you have to do your signature, where you have to mention about the omitted doses. If the patient is allergic to some drug and you are administering the same drug, that can be a fatal mistake and will lead to the direct failure in the same station. Administering wrong medication or not administering medication according to the PRN chart. If the patient needs or doesn't need medication, so make sure you do your assessment properly and give PRN medications as required. For performing clinical stations, there are certain stations that require usage of equipments. To make sure that you know the correct usage of equipments, make sure that you visit website of the exam center to see the usage of equipments and also to practice the equipments before you appear for your examination. Common examples of the equipments include lens sets, insulin syringes. There are different types available, and you're not sure which one you can get in your exam. So make sure that you have practice usage of equipments before you appear for your exam. If you are administering subcutaneous injection, that is insulin, make sure that you have to prime the insulin syringes. Sometimes students forget to prime, and the correct dosage. For example, you have to administer 4 units. Make sure it is 4 units and you are not administering wrong units, and full of the medication is dispensed. So these are the common things. If you'll keep in your mind, you will be able to clear your OSCE examination. And there are not the major things which can fail you. Sometimes it can be the minor of the things in which you can fail. So here at OSCE Expert, we focus on even the minor elements where students tend to make mistake or fail during their examination. We train international nurses throughout their journey to be an RN. So for support and guidance, please contact on the information provided. Thank you.